For decades, we've been conditioned to dismiss minor skin changes as simply part of getting older. A little itch here, a persistent spot there. We're told these are normal signs of aging skin. But emerging medical research reveals a startling truth that could save countless lives. That persistent, itchy spot you've been ignoring might be your body's earliest warning system for something far more serious. I'm Dr. Linda Parker, and today I need to share with you critical information that could literally be the difference between early detection and a devastating late-stage diagnosis. The statistics are sobering. When certain types of skin changes appear in adults over 60, particularly those accompanied by persistent itching, the likelihood of underlying malignancy approaches 99% in specific presentations. This isn't meant to create panic, but rather to empower you with knowledge that mainstream medicine often fails to communicate clearly. Your skin is your body's largest organ, and it's constantly sending you messages about your internal health. The question is, are you listening? Let me start by explaining what happens to our skin as we age and why certain changes demand immediate attention rather than casual dismissal. As we move past our 6th decade, our skin undergoes fundamental transformations. Cell turnover slows dramatically, dropping from every 28 days in our 20s to potentially 60 days or more in our 70s. This means damaged cells linger longer, creating opportunities for malignant transformation that younger, more resilient skin can typically prevent or repair. Simultaneously, our immune surveillance system becomes less efficient. The specialized immune cells that patrol our skin and eliminate potentially cancerous cells before they can establish themselves begin to decline in both number and effectiveness. This creates what oncologists call a perfect storm scenario, where damaged cells persist longer and our natural defenses are weakened. The blood supply to our skin also changes significantly. Decreased circulation means nutrients and oxygen reach skin cells less efficiently, while waste products and toxins are cleared more slowly. This compromised environment further increases the risk of cellular damage and malignant transformation. Understanding these changes helps explain why a simple itchy spot that might resolve quickly in younger individuals can represent something far more sinister in older adults. Now, let's discuss the specific warning signs that demand immediate medical evaluation. The first and most critical indicator is persistent localized itching that develops without an obvious cause. This isn't the general dry skin itching that many seniors experience during winter months or the temporary irritation from new detergents or fabrics. Instead, this is focused, persistent itching in one specific area that continues despite moisturizing, changes in products, or other common remedies. The medical term for this phenomenon is perineoplastic pruritus, itching caused by substances released by cancer cells, or the body's immune response to those cells. Research published in the Journal of the American Academy of Dermatology shows that localized, persistent itching precedes visible skin changes in over 80% of cases of certain skin cancers in adults over 60. The itching often begins weeks or even months before any visible abnormality appears, representing a crucial early warning window. The second critical sign is any change in the texture or color of the itchy area, even if subtle. This might appear as a slight thickening of the skin, a barely perceptible color change, or an area that feels different when you run your fingers over it. These changes often develop so gradually that they're easily dismissed as normal aging, but they represent cellular-level transformations that warrant immediate investigation. The third warning sign involves changes in sensation beyond just itching. This includes areas of skin that become unusually sensitive to touch, feel numb, or develop a burning sensation. These neurological changes often indicate that abnormal cells are affecting nerve pathways in the skin, a development that occurs in the early stages of several types of skin malignancies. The fourth critical indicator is any spot or area that begins to bleed, ooze, or fail to heal properly. In older adults, even minor scratching of an itchy area should heal within a few days. When healing is delayed, incomplete, or the area repeatedly breaks down, it suggests underlying cellular abnormalities that prevent normal tissue repair. Let me share some specific examples to illustrate these principles. Consider Margaret, a 72-year-old patient who developed persistent itching on her upper arm. For months, she attributed it to dry skin and applied various lotions without relief. When she finally sought medical attention, a biopsy revealed early-stage cutaneous T-cell lymphoma. Because she caught it early, treatment was highly successful. However, her case illustrates how easily these symptoms can be dismissed. Another patient, Robert, experienced what he described as a bug bite that wouldn't stop itching on his leg. After 6 weeks of persistent symptoms, his daughter insisted he see a dermatologist. The biopsy revealed melanoma in its earliest stage. Robert's story demonstrates how family members often play crucial roles in encouraging medical evaluation when symptoms persist. Then there's Dorothy, who noticed a small, slightly raised area on her shoulder that itched intensely at night. She initially thought it was a reaction to her new pajamas, but the itching persisted even after changing sleepwear and detergents. Early biopsy revealed squamous cell carcinoma, which was completely removed with a simple office procedure. Dorothy's case shows how nighttime itching intensity can be a particularly significant warning sign. The physiology behind these symptoms involves several mechanisms that medical professionals are still researching. Cancer cells produce various inflammatory substances and growth factors that stimulate nerve endings in the skin, causing itching sensations. Additionally, as abnormal cells multiply, they alter the normal architecture of the skin, affecting blood flow and nerve function in ways that produce the textural and sensory changes I described. Immune system responses also contribute to these symptoms. As your body recognizes abnormal cells, it mounts an inflammatory response that includes the release of histamine and other substances that trigger itching. However, because the immune response is often insufficient to eliminate the abnormal cells in older adults, the itching persists rather than resolving as it would with a typical allergic reaction or irritation. The timing and pattern of symptoms provide additional clues. Malignancy-related itching often follows specific patterns that differ from benign causes. It frequently intensifies at night, may worsen with heat or warm water, and typically doesn't respond to standard anti-itch treatments like antihistamines or topical steroids. The itching also tends to be more intense and persistent than what you'd expect from typical age-related skin dryness. Geographic factors can influence risk as well. Areas of skin that have received significant sun exposure over the decades, the face, neck, arms, and upper chest, are at higher risk for malignant transformation. However, it's crucial to understand that skin cancers in older adults can develop anywhere on the body, including areas that have never seen significant sun exposure. The role of medications in masking symptoms presents another challenge. Many older adults take medications that can affect skin sensitivity or immune responses. Blood thinners can make skin more prone to bleeding and slower to heal. Steroids can suppress immune responses that might otherwise help identify abnormal cells. Pain medications can dull sensations that might otherwise alert you to problems. This medication-related masking effect means that even subtle symptoms deserve attention. Let's discuss what you should do if you recognize any of these warning signs. The first step is documenting the problem. Take photographs if possible, noting the exact location, size, and appearance of any suspicious area. Keep a written record of when symptoms began, how they've changed, and what makes them better or worse. This documentation helps medical professionals understand the progression and characteristics of your symptoms. Don't attempt to self-treat persistent symptoms with over-the-counter remedies beyond basic moisturizing. While there's nothing wrong with trying gentle moisturizers initially, persistent symptoms that don't resolve within 2 weeks warrant professional evaluation. Self-treatment with stronger topical medications can sometimes mask important diagnostic clues or even worsen certain conditions. When seeking medical care, be prepared to advocate for yourself. Unfortunately, age-related bias in healthcare is real, and symptoms in older adults are sometimes dismissed too quickly as normal aging. If your initial healthcare provider doesn't take your concerns seriously, don't hesitate to seek a second opinion or ask for a referral to a dermatologist. Your persistence could quite literally save your life. The diagnostic process typically begins with a thorough visual examination using specialized lighting and magnification. Dermatologists are trained to recognize subtle changes that might not be apparent to the naked eye. If there's any suspicion of malignancy, a biopsy will be performed. This is typically a simple office procedure involving removal of a small tissue sample for microscopic examination. Modern biopsy techniques have become increasingly sophisticated and less invasive. Many can be performed with local anesthesia in a matter of minutes, with minimal discomfort and excellent cosmetic outcomes. The key is catching problems early when treatment options are most effective and least invasive. Treatment outcomes for skin cancers detected early are extraordinarily good. Basal cell carcinomas caught early have cure rates approaching 100%. Squamous cell carcinomas detected in their earliest stages also have excellent cure rates with simple surgical removal. Even melanoma, the most serious type of skin cancer, has 5-year survival rates exceeding 90% when caught in its earliest stages. The contrast with late-stage detection is stark. Advanced skin cancers may require extensive surgery, radiation therapy, chemotherapy, or newer immunotherapy treatments. They may cause significant disfigurement and can metastasize to other parts of the body. This is why early detection based on recognizing subtle warning signs is so crucial. Prevention strategies deserve mention as well, though they're particularly relevant for preventing future problems rather than addressing existing suspicious symptoms. Daily use of broad-spectrum sunscreen with an SPF of at least 30, even for brief outdoor activities, can significantly reduce ongoing damage. Wearing protective clothing and seeking shade during peak sun hours provides additional protection. Regular self-examination becomes increasingly important as we age. This involves systematically checking your entire body monthly, using mirrors to see areas you can't easily view directly. Look for any new spots, changes in existing moles or freckles, or areas that itch, bleed, or don't heal properly. Family members or partners can help examine areas that are difficult to see yourself. The importance of regular professional skin examinations also increases with age. Many dermatologists recommend annual full-body skin examinations for adults over 60, with more frequent monitoring for those with risk factors like fair skin, history of significant sun exposure, family history of skin cancer, or previous skin cancer diagnoses. Technology is also advancing our ability to detect skin changes early. Some medical centers now use sophisticated imaging systems that can detect cellular changes before they're visible to the naked eye. These technologies may become more widely available in coming years, further improving our ability to catch problems in their earliest, most treatable stages. The psychological impact of dealing with suspicious skin changes shouldn't be overlooked. Many older adults experience significant anxiety when confronting the possibility of cancer, particularly if they've lost friends or family members to the disease. It's important to remember that early detection and modern treatment methods have dramatically improved outcomes. The key is not letting fear prevent you from seeking timely medical attention. Support systems play crucial roles in encouraging appropriate medical care. Family members and close friends should be aware of these warning signs and feel comfortable expressing concern when they notice persistent symptoms. Sometimes an outside perspective can identify changes that develop so gradually that the affected person doesn't notice them. Financial considerations unfortunately affect some seniors' willingness to seek medical care. It's worth noting that Medicare and most insurance plans cover skin cancer screening and treatment. Many communities also have low-cost or sliding-scale dermatology clinics that can provide initial evaluations for those with limited resources. The message I want to leave you with is one of empowerment rather than fear. Your skin is constantly communicating with you about your health. By understanding the language it speaks, particularly the critical warning signs we've discussed today, you can take charge of your health in a way that could quite literally save your life. That persistent itchy spot isn't necessarily something to panic about, but it is something to take seriously. In the vast majority of cases, early evaluation and appropriate treatment lead to excellent outcomes. The key is recognizing that persistent, unexplained itching in a localized area, especially when accompanied by any changes in skin texture, color, or healing ability, warrants prompt medical evaluation rather than dismissal as normal aging. Remember, you know your body better than anyone else. Trust your instincts when something doesn't feel right, and don't let anyone dismiss your concerns without proper evaluation. The few minutes it takes to have a suspicious area examined could be the most important medical decision you ever make. Early detection remains our most powerful weapon against skin cancer, and you are the most important member of your healthcare team in achieving that early detection. Stay vigilant, stay informed, and never hesitate to advocate for your health. Your future self will thank you for the attention you pay to these seemingly small but potentially life-saving warning signs today.